So obviously, yesterday on Monday, the 22nd, there was a pretty big announcement about the link between potentially acetaminophen or Tylenol and autism and kind of neuroprocessing or sensory processing disorders. So obviously, if you live on social media, you've probably seen some sort of takes on this, kind of both sides of the aisle. People saying this was a stupid thing to say. There's absolutely no connection, and we should ignore this. And then there's people on the other side of the aisle that are kind of trying to explain why this could potentially be happening. So I just want to kind of cut through some of the clutter with this, and we're going to dive into what the research kind of says on this, because the reality is there's not any research that links acetaminophen or Tylenol to autism. What they're kind of saying is that there's some correlations there. There's some potential mechanisms for why this could have happened. And I think really what we need to do is open up the conversation and open up the door for future research on this. I also think we can't pigeonhole one specific cause for things like autism just because there's so many different triggers that are going on. And after we go through kind of some of the proposed mechanisms here and talk about what some of the research shows, you'll see how there's so many different things that could potentially be triggering this. And I also want to leave you with some kind of an understanding of what you can do to gauge your own risk, your kids' risk, and make sure that you're protecting your own health, so you can avoid not only neuroprocessing disorders in kids, but also things like dementia, Alzheimer's, brain health as we age. So first thing is, the claim was that there is acetaminophen can potentially lead to autism, right? And if we break this down, there's a couple of mechanistic things that are happening. The first one is that acetaminophen can cause glutathione depletion or deficiency within the body. And in autism, there is a link between autism and glutathione deficiency. So let's kind of dive into that. When we're taking acetaminophen, it can be detoxified down three main pathways. So the first pathway is going to be the most common pathway that we detoxify acetaminophen down. It's called a glucuronidase pathway. Now, this is a liver pathway that basically allows your body to clear it out. It changes the form and adds a glucuronal group or glucuronoside group to the acetaminophen. It changes the structure and the shape and allows your body to detoxify that. We don't need to get into all the heavy detox stuff here, but just know that the first main phase of elimination of acetaminophen by the liver is a glucuronidase pathway, and about 50% of our acetaminophen that we ingest gets push down that pathway. The second pathway is the sulfation pathway. This is another major pathway. And the third pathway is the one that really has a lot of focus on in this specific setting. And this is a CYP, cytochrome P450 pathway that oxidizes it, that can create a lot of oxidative stress within the body. Now, this converts it into a different enzyme or a different form that we don't necessarily need to get into. It's MPQ DI, I believe, is a scientific kind of chemical name for that form that can create a lot of oxidative stress. And this gets further eliminated through the body through glutathione detoxification. So if we're pushing a lot down this cytochrome P450 pathway that creates the damage, we're going to then start to deplete a lot of the glutathione that's in the body as a result of trying to continue detoxifying this from the body. So phase one creates this middle stage reactant that's more damaging within the body that then requires phase two detoxification through the glutathione detoxification pathway. The big thing to understand there is that if we're converting more of our acetaminophen down that damaging pathway, that's going to lead to glutathione depletion over time. The thing is that any oxidative stress, and I shouldn't say any oxidative stress, but glutathione is one of the most powerful antioxidant components within the body. It's in almost every single cell, tissue. Almost all of our organs can produce their own intrinsic glutathione, and it's a very important compound for neuroprotection and for brain health. And if we're constantly depleting our glutathione through additional and added oxidative stress in the body, that's going to end up being a bad day for us. So there is a plausible link between acetaminophen and autism simply because of the glutathione depletion. Now, the thing is that obviously not everybody who takes acetaminophen or Tylenol during pregnancy ends up with autistic kids. So we got to ask the question, if acetaminophen is extremely safe during pregnancy and it's one of the most commonly used or the only really safe fever reducer during pregnancy, why are more people or more kids not autistic. And that comes down to the oxidative stress and the amount of glutathione that the mother has when she takes the acetaminophen. And I just want to know, we're going based off of plausible mechanistic data. This is not supported by direct research, and nothing that we're saying here is indicating causation, right? This was obviously brought up by the government, who set out to find out what causes autism by September. They released these findings. And so my whole point of this video is to understand, obviously they didn't just say this for no reason. There has to be some sort of mechanistic data here. So I just want to dive into some of the mechanisms here that are at play, so we can have a better understanding of kind of how 1 + 2 = 3 potentially, right? So with that being said, there's a lot of things that can deplete our glutathione levels, and really high levels of oxidative stress over a long period of time are going to lead to that depletion. And so this is kind of a perfect storm of situations where you've got a lot of oxidative stress already in the body. Maybe mom's got obesity. Maybe mom's got fatty liver disease. Maybe mom's got toxic mold exposure. There could be a lot of other underlying health conditions that have depleted glutathione levels. And so now we get to a point where we're pregnant. We've got a significant oxidative stress load on the body already. We've depleted our body's ability to deal with the oxidative stress because glutathione levels are so low. And now we add another stressor in here. And maybe our bodies are primed to push down this oxidative pathway. And so acetaminophen, instead of getting pushed down a glucuronidation pathway or a sulfation pathway, is getting pushed down through these cytochrome P450 enzymes. And one of the big things that we see all the time when we're looking at hormones and infertility and things like that is on a Dutch test, estrogens can get converted down 3 main pathways as well. One of them is a protective pathway, 2-hydroxyestrone. One of them is going to recirculate into the body, 16-hydroxyestrone. And one of them is similar to acetaminophen, is going to get pushed down a very damaging pathway called the 4-hydroxyestrone or 4-hydroxyestradiol pathway. Interestingly enough, the enzyme that pushes down the 16-hydroxyestrone pathway, which has a tendency to increase estrogen levels, leading to things like endometriosis, is a cytochrome P450 enzyme called CYP3A4. We see this all the time in fertility patients, especially those struggling with higher estrogen levels, anxiety, depression, endometriosis, things like that. That same cytochrome P450 enzyme, so CYP3A4, is also responsible for pushing down the damaging pathway for acetaminophen. So it's very possible that we've got these women that are struggling with fertility. Maybe they've got endometriosis. Maybe there's something going on in the body that's causing them to have a higher or a more active level of these certain enzymes. And that's predisposing them now to pushing acetaminophen down a damaging pathway. And again, this is where we get into this potentially being a perfect storm, right? Where we've got all of these factors that are all lining up for this woman when she's pregnant, and she does something like take acetaminophen for a fever reduction. And now her body doesn't have the capability of dealing with that the way somebody else's body does. This is why it gets so difficult when we start looking at all the research and all the data to say, this is the one thing that causes it, or this is the one thing that increases risk, because everybody's been through so much in their life. Everybody's toxic and stress load is so different that we don't really know without testing where your oxidative burden's at versus where your oxidative burden is at, or where your glutathione levels are at, or where your lipid peroxide levels are at, or 8-hydroxy-DG levels are at, right? So there's a lot of things that could be at play. Now, just simply testing a Dutch test, which is a urine test, you can see CYP3A4 activity on that. So while we're not directly testing your body's metabolism of acetaminophen, if we can see one of the pathways that also does this other thing in the body, we can start to gauge kind of what your risk potentially could be. If we look at a Dutch test and you have very low CYP3A4 activity on a Dutch test and result with estrogen metabolism, well, we can probably also infer that there's probably a low likelihood that you're pushing or shunting all of your acetaminophen into this damaging pathway. The other thing is the glucuronidation pathway. So one of the things we look at all the time on a stool test is beta-glucuronidase. Now, this is an enzyme that's produced by certain bacteria in the gut under specific circumstances. When beta-glucuronidase levels get really high in the gut, they're going to break that glucuronidation bond that we created in the liver, and that allows your body to recirculate that hormone or that chemical or whatever was pushed down that glucuronidation pathway. So with a lot of our females that are struggling with infertility, with hormone imbalances, things like that, this causes very high estrogen levels because estrogen is also metabolized through that glucuronidation pathway and excreted through the gut. So high levels of beta-glucuronidase can cause recirculation and higher levels of estrogen. Well, if the primary metabolism pathway for things like acetaminophen is the glucuronidase pathway, and we're pushing it into the gut and everything's fine and dandy, but we've got really high levels of beta-glucuronidase. Now, again, we're creating that perfect storm where maybe we can't eliminate down the correct pathway as easily, and we're recirculating some of that. And now we've got to find other pathways. And this is one thing they talk a lot about in the research with toxic elimination pathways, is that when that glucuronidase pathway gets shut down or shunted, we're going to shunt into another more damaging pathway. The other things that can shut down some of that glucuronidase pathway have to do with liver gluconeogenesis activation, which is going to happen during times of fasting, low energy intake, or low energy availability. It can happen with fatty liver disease. It can happen with obesity. So now we're bringing a whole nother level of metabolic dysfunction in that can potentially cause the conversion of acetaminophen to get pushed down a harmful or a damaging pathway. So again, we're not talking about one single thing that's causing all of these issues. We're talking about a perfect storm of events that have led to a situation where now we've got this glutathione depletion, we've got this overactivation of a certain pathway, we take something exogenous into the body, it now gets converted down a harmful pathway, our bodies can't deal with that, and we create neuroinflammation. So all of these things play a role, right? If you're wondering, well, how do I know if that's me? That's where we can test for that, right? So like I said, we can run a Dutch test, and we can see what the CYP3A4 activity looks like. On a Dutch test, we can also see what your glutathione levels look like. So we're running an organic acid on that test called pyroglutamate. If that organic acid is either high or low, in both cases, either end of the spectrum, that can indicate glutathione deficiency. That's something that's extremely important to know. We can also measure neuroinflammation through an organic acid called 8-OHDG or 8-hydroxy delta gamma something, right? We can run that. If that's super high, now we know that we have oxidative stress in the body. We have a predisposition to neuroinflammation. We've got a depleted glutathione or antioxidant capacity within the body. And if we load the body up with something that's going to create oxidative stress, now we can't heal the same way as somebody who maybe doesn't have any of those things going on or only has one of those things going on, right? So certain populations are going to be much more susceptible to this damage. So we've got to take that into consideration. And then once we've established kind of what can deplete our glutathione levels, what's creating oxidative stress, how we may be metabolizing some of that acetaminophen that we're taking, or anything that creates oxidative stress for that matter. So obviously we're talking about acetaminophen today because that's what just got released yesterday by Trump and RFK, but there's a lot of things that fit into this pathway or that fit into this oxidative stress pathway, right? So we've got to take into consideration all of these things that can create that stress in the body. Once we've established that that can deplete glutathione, then we've got to say, okay, in autism, is low glutathione actually involved? And so they've done some really cool research studies, which I can link below this because I know I'm going to get flack for this video. So I want to make sure I'm citing my sources, right? So everything I just talked about is literally on the National Institutes of Health website for the pharmacokinesis of acetaminophen. None of that was made up. It's all there. There was some inference in that where we're kind of connecting dots on pathways. I'm very honest and upfront about that. I already said that I'm making some inferences here, but the pharmacokinetics and the pathways and the breakdown of acetaminophen and the glutathione depletion of that, that's literally all on the National Institute of Health website. If you don't believe me, you can go look at it. Talking about now shifting gears and just talking about autism and glutathione levels. They did a research study. I believe it was published in either 2012 or 2021. I can't remember which year this actual research study was published, but like I said, I can link it below. In that research study, they found that in certain parts of the autistic brain, when compared to age and gender matched patients, there was extreme depletion of glutathione. And not only was there depletion of GSH or glutathione, there was an increase in GSSD, which is the oxidized form or the reduced form of glutathione that is an increased risk of oxidative stress in the body, right? And so what they found was that in the cerebellum and the temporal regions of the brain, there was a 38 to 45% reduction in glutathione. And there was also a 38 to 50% increase in the GSSD, or the damaging form of the glutathione, right? So we can't link these two together and say this causes this, but the government obviously said there's a connection and we need to do more research. And we can see how all of these things over here can create glutathione depletion within the body. And then we can see that in autistic patients, glutathione is markedly 38 to 50% in some cases reduced in certain areas of the brain. And again, let me just specify, this does not mean causation, but there is a correlation and there is a mechanistic way that we can get from point A to point B. And when we can create a mechanism that takes us from point A to point B, I think it's worth exploring this further. And so that's where I'm going to kind of leave it at, is that we need to explore this further, and it's worth exploring further. And in expansion on the acetaminophen, we need to explore this in the case of all oxidative stress on the body. And I'm not going to list out all the things that cause oxidative stress, because the video will certainly get taken down if I start talking about all of the things in our medical system that cause oxidative stress in the body. What the action steps that we need to take from this is, there are ways to test. Like I mentioned, we can test beta-glucuronidase levels on a stool test, and we can understand where your glucuronidation pathway potentially is at, and if we're fully able to metabolize down that pathway. We can look at a Dutch test, and we can check out that CYP3A4 pathway, and we can see, do we potentially have an increased risk of pushing down that damaging acetaminophen pathway? We can look at organic acids, and we can test oxidative stress, lipid peroxides. We can test the 8-hydroxy-DG. We can test our antioxidant capacity in the body. We can directly look at glutathione levels in the body. If this is something that you're concerned about, if you want to get pregnant and have kids and want to make sure that you're doing everything that you can to minimize the risk of neurodevelopmental disorders, these are all things I would highly recommend. With infertility, we talk about this a lot in the office. It's not just about whether you can get pregnant. It's about whether you can carry a pregnancy healthy. And so in our office, we're always trying to make sure that women are not only hormonally healthy, but they're metabolically healthy, and they've got all the resources, antioxidants, nutrients, all the things to carry a healthy pregnancy and create a healthy baby. Because at the end of the day, healthy moms make healthy babies. And so if we can get you as healthy as possible before and during pregnancy, we're going to maximize the chances of having a healthy baby at the end. So I hope that this helps to kind of clarify and cut through some of the clutter and the noise out there. I hope you got some actionable information out of this. If you want to have any of that testing done, or you want to take a look at where your body's at and what your risk may be, let us know. We'd be more than happy to get you set up with that testing, and we'd be more than happy to help you and guide you along this process. So take care, guys, and we'll see you next week for another Ask Me Anything or another health topic.